Okay, folks, welcome back to Mindbody Medicine for Chronic Pain. My name is Sean Hershey, and I am your host. And wow, do we have a cool interview today, or do we have a cool interview today? Wow. First, Mindbody field celebrity, Dr. Dan Ratner, is here talking to us. How cool is that? And the conversation was like, I would call it exciting, maybe like energizing. It's a really like energetic and fun time. Like Dan is cool and he is totally on fire with this stuff. So this I bet this, first of all, you'll learn a lot from this interview today because Dan gets like granular level detail. He knows this stuff inside out, back, forward, up, down. Like he knows this stuff. And it's just energizing. Like this is going to pick up your energy. If you need that, you will get that today. Okay, so before we get to the interview, let me just briefly say this. If you're interested in one-on-one individual therapy, great, you can contact me. I'm available. The easiest way to contact me is through my website, which is mindbodymedicineforchronicpain.com or seanhershey.com. Both of them will take you to the same place. If you're enjoying the podcast, which I'm like, after this interview, like, I believe you will be enjoying the podcast. Please rate and write a written review. That would be awesome. Much appreciated. It helps people find the podcast. And if you want to follow me on Instagram, I am there at mygaytherapist. Okay, so let me just do a little introduction. Let me read this about Dan Ratner. If you don't know who he is, here are the basics. So, Dr. Dan Ratner is a leading international expert in the mind-body field, host of the Crushing Doubt podcast on YouTube and Apple Podcasts, and author of Crushing Doubt, an advanced system for mind-body pain and symptom relief. That book just came out. After his life-changing experience resolving 8 years of chronic back pain through mind-body understanding, he's helped hundreds of pain and symptom sufferers recover. His unique 3-column system uses science and logic to organize mind-body understanding and alleviate both acute and chronic symptoms. His teaching seminars make comprehensive sense of the mind-body process, putting lingering and problematic questions and doubts to rest. His weekly membership groups allow ongoing, cost-effective access to him to facilitate columns work. His book, seminars, and membership groups are available at www.crushingdoubt.com. So there we have Dan, and I just want to, yes, if you go to the website, seminars, groups, guides, courses, link to order the book, all that stuff is right there. Highly recommend you check it out. And yeah, without further ado, let's get to this interview with Dr. Dan Ratner. Hello, everyone, and welcome back to Mindbody Medicine for Chronic Pain. My name is Sean Hershey, and I am here. I am so lucky to be talking to Dr. Dan Ratner. Hi, Dan.
Hey, Sean. It's great to be here. Really excited.
Yeah, I'm just so glad that you are here talking to us today. I mean, I feel like I've learned so much from your stuff and from your methods, your 3 columns. It's really helped me like organize my mindset around pain stuff. But let's start with I assume most people listening to this podcast probably have a sense of who you are or have heard of you before. But if, some people have not, why don't you introduce yourself and tell us about, what you do and how you help people?
Sure. So, I mean, one of the interesting things I find about the mind-body field is like our degrees almost don't matter as much because we're kind of specializing in lots of things that have overlap. But I'm a psychologist. So, I work a lot with the MDs in the field when I need to get a medical consult. But I'm a psychologist that came to this field. And for anybody who doesn't know me, it was after 8 years of chronic everyday back pain that I did not think was going to get better. I didn't know about mind-body stuff much. I mean, I was a psychologist, so I was aware of the idea of something that could be psychosomatic, and I even wondered about it directly, but it wasn't until I discovered Dr. John Sarno and his works that I was like, oh my God, this is what it is. And so I came to it through the actual, suffering lens and getting better. I didn't get better from a book cure per se, but the information that started to trickle in made me feel confident that I could get better. And then I just kept working at it. And then I developed this system initially just for myself. It was like I had to organize my own mind to once I realized it was mind body, I was like, well, I got to get control of my mind because that's the thing that's going to determine what happens here. So I organized my mind, and what came out was this system, and which of course we're going to talk about. But I've really been thrilled to find over the last 14 years since that it has helped a lot of people. So of course, I have a podcast myself, and
Mm,
I do trainings. I have
mm.
groups that I run. I have seminars, and now just recently published my book,
Yes.
which is also called Crushing Doubt, same as the podcast.
Yes. Yeah, awesome. Yeah, yeah, no, thank you. And, we'll definitely make space at the end. I wanna give people all the information about, like, the stuff that you, offer. So definitely make space for that. We'll put a pin in that. Um, I just wanna say to follow up on what you're saying about coming to this through like, your degree doesn't really matter. That's something that I'm like, I didn't learn much about this in school to be a therapist. I learned a lot and I use those skills as a therapist still all the time, but I didn't learn about this. I mean, say a little more about what it was like to come to this as a psychologist and like you thought maybe it's psychosomatic, but this is like different and more and sort of more like evolved than that. Like talk about like what it was like to come to this from your professional perspective.
Yeah, it's a great question. And I'll start with the term psychosomatic. To me is a very misunderstood term. It was even by me.
Same.
You end up. I think it's a word that means to people it's in your head. You're making it up, and that's not at all what's happening. But what's happening in the brain becomes very real in the body, and it was incredibly eye opening. Nothing has been more eye opening to me, Sean, than recognizing what was going on for me with my back and seeing, wow, psychology didn't get this, the medical field didn't get it, my family and friends didn't get it. Nobody knew about this. It was mind blowing to me.
I know. I know. I
So
know.
it made it so that I don't know how it was for you, Sean, but I just ended up feeling like I cannot continue on the same path knowing what I know now. It changed everything.
Yeah,
And
I
so
agree.
yeah, I mean I had to change my practice radically. A good example of that, in terms of what we learn in graduate school for the kind of degrees that you and I have. I think we have different degrees, but it's
Right,
similar.
right. MSW, and you are a
I'm a
psychologist. Yeah.
PsyD, but
Okay.
it's very similar training.
Right. Right.
And one of the things that they really train you about is to not disclose much about yourself. I don't know if that's what they taught you in your graduate
Oh.
school,
Oh yeah. Yeah.
but I mean, I was taught like don't disclose anything. And what I was thinking is I was like, I it was really in reading Dr. Sarno that I was like, even he was disclosing things. He was like telling us about his own experiences and how he thought about this. And I was like, that was an incredibly healing part of the journey. So a huge part of what changed in my practice is I started telling people about my experience with the pain and the symptoms. And really what I found ever since is there's almost no reason to not disclose whatever you want to disclose as long as it's good for the person you're working with. You don't want to do things that are not good for them,
Right.
but
Totally.
actually it makes for a better healing journey and connection if you're just really you. And I
Agreed.
loved that. So
Agreed.
it's like that my symptoms helped me sync up with myself in so many ways, including how I was going to be with other people in the
No,
in the field.
absolutely. Absolutely. And self-disclosure like I mean from both sides of the I don't know, in both chairs, like in the chair and on the couch. It's helpful. Like it's helpful when you're the client to know what like things that your therapist has been through. Like for me, like I saw the TMS therapist Liz Wallenstein last year for a while, and
Sure.
that was so helpful for me. And I know you know her, and
Yeah, Liz is great.
yeah, oh, she was an excellent therapist, and I knew.
not a ton about her, but I knew a little bit about her. And one thing I did know is that she struggled with chronic pain when she was younger, and that she is now doing well. And it helped me because when she would say things about like, well, chronic pain patients typically have this, or that, or like I myself had this, or that, I'm like, oh, I don't feel ashamed or embarrassed because I'm sitting here with somebody else who is a respected professional who I trust, who's been through the same stuff. And that feels so nice to me. So there's that side. And then on the other side, as a therapist, it's just really nice to be able to be yourself a little bit. Like
Yeah.
that feels good.
Yeah, because I kind of felt like I had to live two different lives. And I didn't like that. Like I'm a guy who likes to joke around, and of course, you got to pick your times
Right.
in a therapy process with that. But
Right.
I just wanted to be more fully myself,
Yeah.
and I think that often symptoms are pushing us or asking us to be more fully ourselves. And
Yes.
I totally agree with you too. I mean, when I tell, it's almost like it's one of my credentials is 8 years of back pain. Like
Yeah. Yeah.
people hear that and they're like, "Oh, okay, I can listen to." And if I think about it, even there are some great people in the field who I don't know how it happened, but they mysteriously didn't have these symptoms and yet got into this line of work.
Mhm.
And some of them talk about that being a challenge for them, that they don't have the particular specific experience that they can say, I've been here.
Mhm.
And I think it's such in a weird way, I feel kind of lucky to have that.
Mhm. Yeah, absolutely. I mean, I'm just so grateful to have found this specialization in the field of, psychology, mental health more broadly, because it's a place where you don't have to like, I think a lot of my training was like trying to like seem really like uptight and perfect and like I have it all figured out, which is not true. It's not true for anyone. So being able to like sit in this work and be like, oh yeah, I'm a work in progress all the time too. It's like, thank God. That just makes my life feel so much easier.
Yeah, for sure. I mean, and that's how everybody is.
Right. Exactly. Exactly. And for people listening, I hope you know that if you are a work in progress, you can recover from chronic pain, even though you are a work in progress. It's not a journey of perfectionism. It's not.
Not at all. You don't start out perfect. You don't even finish perfect. There is no finish.
Right. Right. Okay. All right. So I know your healing methods are very holistic and you try to cover like everything. Which I love. So I try to do the same here on this podcast, covering like the psychological mindset, covering the emotional side of healing, and then covering like attuning to yourself and listening to your body and being kind to yourself. Um, and then getting all of that both in the mind and in the body. So it's a lot, but I like you have a very good way of dividing these things into three columns, I know as you call them. So would you some listeners, I'm sure, have heard some of your stuff and are familiar, but would you give a brief overview of the way you organize your three healing columns?
Yeah. I mean, first of all, it gets the name columns from when I would first meet with people after I got better. I would have them take a sheet of paper and divide it into three columns. That's how it got the name. But it was all to organize. And what I found in my own recovery process is it became very important first to separate out that some of these symptoms were coming from feelings and some
Hmm.
of them were coming from my thinking,
Hmm.
like not even related to the feelings. So first it was two columns. I was just separating emotions and what I call doubt, which is thinking gone awry.
Yeah.
Um, and then I discovered after I got better this thing that I call power, which a way to talk about it is just self alignment. So you've got feelings, you've got thinking, and you've got relationship with the self.
Yeah.
And at any point in time, your symptoms are going to be pointing in the direction of where you need to do that work. Do I need to discover something about the emotions? Do I need to alter something about my thinking? Do I need to change something about my relationship with myself?
Hmm.
And that's really what dictates it. I can say plenty more, of course. I have tons to say about it, but that's the basic gist.
Yeah. Well, let's go a little deeper on power because that's one that you're the only mind body provider, and honestly, maybe the only like psychologist or mental health professional who I know who really like talks up power like that, which is awesome. And I'm curious, because the way that I look at that aspect of the work, the way that I've described it on this podcast and the way that I describe it to my clients is more like attuning to yourself. And we're using like different language to get to the kind of a similar concept. But talk about power, because I get it. I get why, like, yeah, that is powerful. But I'm sure some people listening wouldn't really be making that connection. So talk to us about power.
Yeah, there's many things I can say about it, so I'll say some stuff and then chime in as needed or ask
Cool.
more questions. But
Awesome.
the basic gist I found with power is that it's not only about attunement with the self, it's also about making adjustments so that you can live in a way that is very authentic with you outside in the world. So there's syncing up with yourself and getting to a more peaceful and calm place with yourself where you can really just be yourself.
Mm-hmm.
And that's incredibly healing all by itself.
Mm-hmm.
But then you start to live that in the world. And in a way, we already talked about that, because when we talked about how we adjusted as therapists, when we started disclosing things and started being more ourselves, that's power right there. That's deciding I'm going to be me, like unapologetically myself. And when you do that, it opens doors to all kinds of things that you didn't think were possible. I'll give you a great example, Sean, but
yeah.
I used to never really lead much of anything. I always wanted to be like second in command. I didn't want to be out there. I didn't want to be noticed. And that was because I came from a trauma history. Getting noticed was not generally a great thing. So power also is about daring to step into the light and be as fully powerful as you can be. And now I actually, if I'm in something, it's hard for me to not want to assume some kind of leadership role. I can play all kinds of different roles, but it's like I've changed my default setting with myself, where I used to be back on my heels in life because of the trauma and the sense of danger everywhere. And now I'm like, I'm excited. I'm leaning forward into things. I'm like, I come into a room and I'm like, I'm here, and I'm excited about that. And I'm excited to tell people who I am. And so there's just there's a comfort with the self that you can find. And I will say this, I had over 20 years of therapy that didn't get that done for me.
Yeah, I believe it. Yeah.
So much of that therapy experience was about learning about myself, getting the insight, but not much of it was about what are you going to do about it? How are you going to actually stop betraying yourself? How are you going to stop sacrificing yourself to other people? I'm all for helping other people. I'm still like total goodist, as Arno put it.
Same, yeah.
But now it's more channeled, and one of the people I'm a goodist to is myself.
Yeah.
That was not true before.
Yeah. I mean, I'm like, I have so many reactions to that. I guess the first thing I'm thinking is like, isn't that so powerful that like when you learn to like, I feel like what we're doing is like learning to speak the language of the body, and the language of the body is like, if you're not listening to it, or you don't know how to listen to it, or you were never taught how to listen to it in childhood, the language of the body starts screaming at you, and it's symptoms and it's conditions and it's a lot of pain and it really sucks and it's a shitty language. But when you learn how to listen to it and interpret it, which is key, because you can also be listening to your body and be like, oh, wow, I need a surgery. I need meds. I need an epidural shot. I need whatever, whatever they give people, cortisone injections. You can listen to the language and totally misinterpret it, or you can listen to the language and like get it. So what I'm hearing is like doing this kind of work helped you like understand what your body's really saying, and that helps you be you.
Absolutely. Yeah. And, I think you'll completely agree with this, but like our bodies are us. So
Yes.
it's us. It's what we're saying to ourselves. But
Yes.
yeah, if you're not attuned to it, or if you're misinterpreting it, you won't hear what's being said. And if you don't hear what's being said, your body will continue to say it.
Absolutely. Let me ask you about your book, because I mean, that's huge. Like that just came out. Talk to us about the book, Crushing Doubt.
Yeah, I mean, I'm really, really proud of the book. I worked incredibly hard at it for multiple reasons, but one of them is, because I specialize in doubt, I know what's going to cause doubt. So every sentence, every word, I was like, okay, what doubt is going to come from this? Because the last thing I want to do is be providing more doubt for people.
And it's so easy. It's so easy to fall into a trap. It's so easy.
Doubt will come in around one word. It can come in at just a look of your face.
Right. You know, I'm glad you're saying that, because I didn't even really realize that, but that same energy affects me as I'm doing this podcast. I'll say like the littlest words I'll say, I might look back and be like, oh God, someone's going to think like it's all a lie. It doesn't work. I'm not doing well. Nothing helps. And it'll be just the littlest word that I'm like, someone will interpret it that way. So thank you for naming that, because that's so true.
Even like an upturn of your tonality. Like, right. And I've had it happen so I do weekly Q&As, and when I do them and sometimes I answer a question that helps one person, but raises doubt in another, because they're like, oh, that helped them. Why doesn't it help me? And then they're off and running. Right.
Yeah.
So doubt.
Let me just briefly butt in to say, like, so listeners who are listening to this, if you notice that happening to you, okay, like, don't take that as truth. Take that as doubt. If something that Dan or I ever says makes you think, oh God, it's not going to work for me, it's not real, question that. But yes, please go.
Yeah, no, I mean, the first thing you do with doubt is to observe it, which is to call it into question. The easiest way for doubt to get through is for it to convince you that it's true, what it's saying. It's not a doubt. So that happens very, very regularly for everybody. But in writing this book, I also, I feel very strongly about these things that I share in terms of how they can help. And I had to go over and over and over it to be like, what form is best for people about this? So the way that the book ended up coming together, I had an editor who helped me think through the structure of the book. And it starts off with my personal story, my backstory. And I felt that was incredibly important to include. I showed it to my parents close to the time I was going to publish. And my dad, he does not suffer in these ways at all. This is my adoptive father, because my biological father passed away when I was younger. But my dad said, maybe you shouldn't include all the details. Like, maybe it's getting too detailed. And a couple people said that to me. And what I decided is, no. I have to use my inner guide, which is, this book is everything I wished had been there for me. I loved Dr. Sarno, and he completely saved my life. But this book, to me, takes certain things further that I would have wanted to go further. So first, it's the story of me. Then it is the science and the logic, and just laying out this very strong argument for mind-body experience and why we can believe in these things. And I just wanted that all like in one place. And that's the first section of the book. There's 3 sections.
Awesome.
So that gears them up to then dive into the system. Then in the second part, I describe the columns. I talk about what they are. I talk about what you do in them, why they're useful, what they're useful for. And then we move into the third section, which I call action steps. Action steps, to me, aren't necessarily about things you do in the outside world. They're changes in the mind. A change in the mind is an action step, especially in the mind-body world. So I lay out for each column all these different action steps, all these things that helped me. And there's got to be over 500 like things that I say that you could do. And that's, you can develop more. But I just wanted to orient people, because I think what happens when people read Dr. Sarno or a lot of books in the mind-body field, they often, I heard them asking for the same thing that I was asking for, which is, but can you help me with how to implement it?
Right.
So the third section of the book is not only how to implement it in terms of the columns, but then in the last chapter, I talk about how can we implement mind-body understanding in society, and why is it so important? And I'm really, really pleased with it. I think it's the exact book I would have wanted to write, which there were so many times in the editing process and in the writing process where I was like, am I ever going to get there? Is this ever going to get where it needs to be? And now when I pick it up and I read something in it, I'm like, That's pretty good.
Good.
I'm like,
That's great.
yeah. I actually I've not picked it up and read any lines where I'm like, ooh, I wish I had changed that. I
Good for you. That's
I
really
don't
cool.
feel that way.
Good
Yeah.
for
I
you.
mean, maybe in time I'll shift in some ways, but so far so good, and the response has been really, really positive.
Good. Follow-up question to this. Will there ever be an audiobook? And I'm asking because I am such a bad reader and I have mild dyslexia, and I started the book and loved it, and I dropped off because if it was an audiobook, I would be done
All right.
weeks
Well,
ago.
good news. Yes, there is going to be an
Oh,
audiobook.
hell
I
yeah.
I will be reading it myself.
Good.
And I had meant to get started with it like right away after writing the book, but I honestly just was like, I need to just lie down.
Yeah. No, wait, good for you. Take a little break.
And then I also had other things that happened because I published the book, and then there was an influx of people coming to see me, and I had to rearrange my groups, which are all designed to be able to implement the system and be able to see me regularly to do it.
Mhm.
So I had to do that, and the Audible version is up next.
Good. Oh, I
So
can't wait.
I'll be getting started with that, I hope, sometime within this month. And I don't know how long it'll take to crank out, but it's coming.
Yeah, no, I love that. I love that. Let's get a little deeper into doubt. Like that's your specialty. Let's go there. Like define doubt for us. Talk about like what is that? Like let's get into that.
Okay. So there's many ways that you could define doubt, but the basic gist is it's any thinking that gets you into a negative mindset about the mind-body process and how you can get better or whether you can get better. So there's actually what I call 3 levels of doubt.
Hmm.
Level 1 doubt is this mind-body or not?
Hmm.
If you're not certain that it's mind-body, then you're in trouble in this. Now, that doesn't mean that anybody's in trouble to be in that space, but we want to move out of it. It's very, very common to not be sure if it's mind-body. That's where everybody starts.
Yep.
But Dr. Sarno said you have to accept the diagnosis. So to me, accepting the diagnosis means accepting that it is mind-body and being certain about that.
Mm-hmm. Yeah, and I just want to say, when I mean, something I talk about on this podcast a lot is my hip pain. When I started, I did not. I had a lot of doubt, I think is the best way to put it. I was going to say I didn't believe it. Parts of me did believe that, like, oh, this can get better. This is TMS. This is a mind-body condition. But I had a lot of doubt. Now I know for sure, and I just want like people to know that like that journey is so normal. When you start this, you will think it's not true. It's not going to work for me. My symptom is different. You will think that, and that's normal. Just not putting a point on that.
I think that's great. Not only is it normal, but it's actually like almost a prerequisite. There's nobody who comes in certain about this.
Right.
There's no way. Let me back up for a sec, because actually, if I need to define doubt just generally, it's simply a lack of certainty. And everybody has a lack of certainty.
Yeah.
But there are different forms of a lack of certainty, and these levels that I'm talking about are part of it. You can be uncertain that it's mind-body, or worry it's structural or physical. You can even think it's mind-body. This is what I call level 2 doubt. You can think it's mind-body, but think my mind-body symptom is going to be harder to conquer than others.
Right.
That can happen for all kinds of people. And then there's what I call level 3 doubt, which is I know it's mind-body. I know that all mind-body symptoms can be conquered just like any others, but I'm not sure I can do it. Or I think there's something in me, some characteristic in me that's going to hold me back. So those are some of the baseline doubts that we deal with. Then there's the forms of doubt. It comes in different forms. It's all lack of certainty, but some forms of lack of certainty are worse than others. The worst one is fear.
Yeah.
Fear is doubt that has you at just a fever pitch, a total panic. And you can barely think when that's going on. Then there's underneath that, let's say you bring down fear, there's confusion. Confusion doesn't sound like a good place to be, but compared to fear, it's much better. You can think straight. You can say, I don't get what's going on. And at least then you can start to look at the problem. In fear, you got to bring down the fear first. Then there's confusion. Once confusion's brought down, then you get to what I call just like garden variety lack of certainty. So it's all lack of certainty, but here you're just like, okay, I'm not totally afraid anymore. I'm not totally confused anymore, but I'm still not sure if this is right. And then once that's resolved, you get to unanswered questions.
Mm-hmm.
That's where I was after I read Dr. Sarno. I was like, I'm pretty certain that this is right, but I don't understand this, and I don't understand this. So there are these little pockets of uncertainty, and I call unanswered questions the gold standard of doubt. You want to get to a place where that's all that's left, because if you do that, then you can start to go get your questions answered. And when you get your questions answered, doubt shrinks and shrinks and shrinks and shrinks. So really, it's about becoming more clear. It's about getting clarity.
That's awesome. Let me ask you this as a follow-up, because I don't know about this, and this is actually something I did your online seminars as part of my recovery and like getting all of this like to make sense in my head. And I would recommend that to anyone. Dan was it 8 seminars you have online? It's like an 8-piece.
Yeah. There are 8 sessions. They're 75 minutes each. They're pre-recorded. I actually am going to be doing a live one probably sometime in the next year, because I like to update it as I get more and more information.
Cool.
And it's just a nice opportunity to do it in person with people.
Yeah, no, awesome. Well, I did whatever the recorded ones were, very helpful. I mean, so much information. I definitely recommend that to people listening. Very helpful. Okay, so here's a question. I'm like so glad I now get to ask you this, like actually for real. A question I had about that doubt, like I totally like in your conceptualization, is part of doubt like doubting yourself, like doubting that you can handle things and therefore like feeling that things are like threatening to you and you can't handle life? Like, would you call that doubt, or would that be more like power work? Or, you know what I mean?
Oh, I know exactly what you mean.
Okay,
I even know why you're asking that question. My answer is so aligned with that. Okay,
talk to us.
So I just talked about those levels of doubt. Level 1 doubt is it mind body? Level 2 doubt is my mind body issue harder to conquer than others? That you can use science and logic to conquer those. There's actual answers like in the outside world that you can point to, generally speaking, and be like, okay, I can put that one to bed. Self-doubt is level 3 doubt.
Yeah. There we go. Yeah.
And you can't win that with science and logic. There is internal logic, but generally speaking, there's no science of you.
Right.
And in fact, there's all kinds of, you have a lifetime of experience with you,
right,
knowing what the struggles might be, knowing how you respond. And typically what happens is we expect ourselves to do exactly what we've always done.
Yeah.
So when you have doubt about yourself, it can feel hard to overcome, because you're like, well, that's what it's always been like. How's that going to change? So, you've got to deal with the basic idea that there's self-doubt in the doubt column. You just expose that it's there, but very quickly, that's power work.
Yeah.
When there's level 3 doubt, you work on that in the power column. So the power column is where we look at, why do you have self-doubt?
Right.
Where did it come from?
Right.
Is it right? And by getting to relook at our story, and it sounds so like cliche, like therapy, like go back and look at your story. And that's what we're supposed to do in therapy. But I found that that's not what therapy did for me. It was maybe it's the way that I did it. I don't know, but it ended up being too intellectual. And I just didn't get the depth to which I had suffered. And power column work helps you really understand the full degree to how you've suffered, how it impacted you, why you have that self-doubt. And when you see it, it changes your relationship to that self-doubt. You start to realize, oh, that was like baked into me by other people, by intergenerational trauma. That's not me.
Yeah.
So we get some separation between ourselves and these belief systems that were kind of shoved into us, or however we want to phrase it. And we start to gain some space to realize I don't have to continue that kind of relationship with myself. I don't have to be aligned with that self-doubt.
I love that makes a lot of sense. And I'm like, okay, so that there's a step for me to take working on the self-doubt. I love that because that really resonates. Thank you for answering that. And
Sure.
I also want to add on to that, like, I think a lot of, talking about therapy, and people's experiences in therapy, a lot of people are very hesitant to, conceptualize themselves as like what they've gone through is traumatic, or certainly think anything poorly about their families. or that that anything about their family upbringing would have been, you could call it traumatic, would have been damaging in some way. And something that I think is so powerful about that is like when you're in therapy and you're renegotiating your relationship with your family, like your internalized sense of your relationship with your family, you're not just renegotiating your relationship with your family, you're really renegotiating like your relationship with yourself. Because I totally resonate with what you're saying. And I just want to like underline that like a couple times for people, because if you believe that there are problems in you and it's no one's fault except for yourself, that's not true. If you see like there are problems in your life and those problems were like given to you, those problems were put on you, those problems were co-created between the environment and you, then you can see yourself more accurately and it's no longer all your fault anymore. And then you can learn better how to be yourself and how to have a relationship with yourself when you know like, oh, that's not me. So that to me is really important. But what do you think of that?
I mean, I couldn't have said it better myself. Everything you said was perfect about that. And I'll add a couple things, but one is that you could look at self-doubt as this weird form of protection from the pain of recognizing how you've actually suffered. Like
Yes.
we almost don't want to put the blame on our family because it hurts to recognize that it actually did hurt.
Speaking TMS language, yes. Go ahead.
Yeah, right,
Yeah.
right. And so, I mean, I remember thinking things. I mean, I have a very good family in a lot of ways,
Same.
but in some ways, it was really not good.
Same.
Same.
And
it's not necessarily anybody's direct fault individually, but there are times where I see it that way.
Yeah, that's legit. Yeah, of course.
I think what we, as a society, we need to get better at calling a spade without that meaning the judgment is so severe. Like, but at the same time, I talk about in the emotions column. The emotions column, I say, is a judgment-free zone. You've got to let in everything. You got to let it in fully. And then in the power column, that's where you can decide, what does it all mean? What do I do about it? And that's self-doubt is kind of a protection against experiencing the pain. Whereas we think of self-doubt as like, well, that's just real. That's just my problems. That's how I'm messed up. And as you were talking about that, I was thinking, yeah, it really is true. We are these very impressionable little kids. We don't know. There's no way that we created our own problems all by ourselves. There's just no way. It's impossible.
Right.
And I'm a parent, and I've seen it from the other side, and I'm very comfortable with the idea. I say that trauma rolls downhill. The parent owes the kid, not the other way around. And we all have to try to stop that trauma from rolling downhill. But I also want to comment on one other thing, which is the word trauma, which I think you brought it up very beautifully, that people often don't like that word for themselves. They feel like it means that they're messed up or their families are messed up, and everybody's family's messed up in one form or another, and we're all struggling in certain ways.
Yes, like thank you for normalizing that, because yes, if anybody's listening and they're like, some families don't have any problems, not true. That's everyone.
No,
but
in
go
fact,
ahead.
families that claim that they have no problems, that is a problem.
That's literally, Dan, you're talking about my family.
Okay.
Yeah,
All right.
and I will tell you that is a problem.
Yeah. So what I found is that I didn't like thinking about myself as having been through trauma because it felt like it weakened me in my mind. It was like I was saying, I'm giving in to this woe is me attitude, but that's not what it is. To really accept your trauma is not about woe is me, and it is not about seeing yourself as weaker. Precisely the opposite. I think that trauma is power.
Yeah.
It's like almost all of the best things that I do in my life, they actually weirdly come from my trauma and how I mastered it. Like, it kind of makes us who we are. I will take out kind of. It makes us who we are.
Period. Yep. Period. I love that. I love that. Let me ask you this. So I know you do a lot of work with clients who are like already working a mind body recovery path of some kind, but they're like not seeing the results they want to see, and you help them like take the next step and get better. Um, for people listening to this podcast, like what do you see? And of course, I'm sure there's a million things, but like, what do you see as common like patterns, places where people typically get stuck, places where like you often see people get stuck, or advice that a lot of people tend to need? Like, what advice do you have for people along those lines?
Fantastic question. I'll give my first answer and then we'll keep the discussion going. But my first answer to that is that you need to understand that different things work for different people. But not only that, and this may be even more important, is that different things work for different people at different times.
Mhm.
It's really about understanding the moment.
Mm.
So what I find is people often get snags working with an intervention or even a great person in the field who does great work, but they don't know when to pivot to something else. I can give you a couple of examples.
Yeah, please.
So, one thing that people talk about in the field is somatic tracking, which is like experience the symptom, learn to not be afraid of it.
Right.
My rule of thumb is it doesn't matter what you do, it matters what you're thinking while you do it. So if you are doing somatic tracking while terrified, it's not going to do anything for you, right? It's just going to make you more terrified.
Right.
But if you're doing somatic tracking in a way where you're like, okay, I can see this is making it a little less scary.
Right.
Then that's successful. So that shows you there's different moments. Journaling is another great example of this.
Mm-hmm.
Journaling's fantastic for so many people and for so many reasons.
Mm-hmm.
And it's not even my specialty. There are people in the field who specialize in that, like Nicole Sachs, and I have tons that I can learn from all these people. But what I've found is journaling's the same way, that if people are journaling and they're looking for that emotional experience, but really what they're having is doubt, then they're not really addressing what's going on. I call that beating your head against the emotional brick wall. It's like, what's the emotion? What's the emotion?
Right,
what's the emotion?
Right, totally. It's like the emotional work will help them if they're able to also bring down the doubt. Like, it's like you have to do it all. That's why it's hard.
Well, and that's why I feel like you need the whole system. You need all three columns, generally speaking.
Yeah.
And so the way I think about it, and the best way I can answer your question about what do people get stuck on is they don't realize that the moments are different. And you just need to know which moment are you in.
Yeah.
Another good example of that is like the emotions column is used for the onsets and upticks in symptoms, which is very different than having 8 years of back pain. That was about doubt.
Right.
So you need to know, like, what are the symptoms saying? When is it about aligning with myself? When is it about bringing down doubt? When is it about getting the emotional awareness?
Right.
It's all about when.
Yeah. No, that's
when to use what.
And I know one thing that you shared, I forget where this was, but I know you talked about this on your podcast maybe too. When do you use the different columns? So I know you actually have a very specific, like, onset and uptick. That's that's an emotional thing. Like, lay it out, like 1, 2, and 3. When do you use the different interventions?
Okay, so onsets and upticks. When the symptom first comes on, or when, let's say you have a symptom, but it suddenly goes way up, that's when I'm like, okay, look right at emotions. You want to find, because that's what I found was always true for me. And as I explored it over these last 14 years, it's always been this way. The onsets and upticks are almost always about emotions. The one exception is what I call doubt triggers, which is like you could do something like an exercise and then you get a symptom there.
Yeah.
That may not relate to emotion at all. That could be a doubt that started with the event, but I consider that doubt. That's like all about thinking, and it gets you into a kind of seemingly chronic symptom. I never use the word chronic alone. I always say seemingly chronic, because none of it's chronic. I have a different term for it, which is consistently acute.
Yeah. I like that. I like that.
Yeah. And if you think about what that means, consistently, that describes why it's always there. But acute means you could make it go away if you change the right thinking. So It's the duration of the symptoms and when the onset was, that's going to determine is that emotions for the onsets and upticks? Is it doubt for the seemingly chronic? And the way I recognize power column symptoms is a symptom plateau where people have gotten better to a certain point and then they just kind of get stuck. It's usually at a relatively low level symptom, but they just can't get it to budge from there. And a lot of times people think, well, that must be doubt because it's not budging. But it's a different form. Like doubt tends to be higher symptoms. It tends to be, there are a lot of thoughts that you're really aware of. With power, a lot of times you're just like, I don't know why I'm stuck. I feel like I should be good. So there's those ways of recognizing it. Then there's also the flow of the columns determines where I go in the work. The way I think of the flow is bring down doubt, then learn about the emotions, and then everything will flow towards power. So when people first come to see me, my assumption is we're going to work on doubt. That's the very first thing. Because if doubt is there, it covers over everything. It disables your ability to do the other work. But once that's down and your thinking is in a pretty good spot, then you can do the emotional work. And I say that the emotions and power column are both emotional columns. But the emotions column is to gain awareness. And the power column is to decide what to do about it, to make adjustments.
I love that.
Yeah. So, I think the system allows me to look at any moment and say, okay, I see what's going on. And I'll give one little tip about that too.
Cool.
It's all about the order in time. Like what leads to what? So if a doubt leads you to feel helpless and then you start to feel that you are an incompetent person and then you get an onset or an uptick. Yeah, we would look in the emotions column for that onset and uptick, but we need to go back to the source, which was you started to have doubt right there. Or your power dipped. Any one of these columns can lead the experience. I find it's really helpful to think about in the order of time, which came first. There's like that thing that happens with parenting where they say like, I don't care who started it. Guess what? I do care who started it.
Right.
Yeah.
Call a spade, like you said earlier.
The one who started it is the problem.
Right.
The response to it can be another problem,
right?
But it's not the main problem.
Right. Something that really stands out to me in what you're saying is like it's such like granular level of detail which you're able to help people with the system, which is awesome. And I can imagine that some people might be hearing this and getting like a little like overwhelmed, like, oh my God, it's going to be hard to know what power, doubt, emotion, like it's a lot. But I do want to, if people are thinking that, I want to like just widen the lens because these are the three things. And it's very similar to the way that I talk about it. It's like this is what causes chronic pain, and you don't have to look outside of that. Even if this stuff does feel like a lot, it's when you take away, like, was it because of the squat rack? Was it because of lifting this thing? Was it because of the food I ate? Was it, all that stuff? You can take that all out, all of it, and instead focus on this. And so while it may, maybe it feels like a lot, but doing this work, you also get to get rid of like all the bullshit and focus on like you. I mean, what's your reaction?
There's only one cause to it all. And I think really everybody in the mind-body field, we agree with that. There's really one cause. It's the link between the mind and the body. It's what happens between the mind and the body. But let me also say something else about people who, first of all, it's normal to sometimes feel overwhelmed by, it's even called a system like that. Even that word is like, oh my God, I have to learn this whole thing,
But again, I just want to go back to calling a spade a spade. It is a system. No matter if you're teaching it, if I'm teaching it, if Nicole Sachs is teaching it, whoever, it's a whole system. It's a whole new way of thinking. So like you're being honest by calling it a system.
Well, I appreciate that, Sean. And but I will say this: one of the designs of the system is to simplify. So like you always start off at the maximal level of complication because you're trying to figure it all out. But the whole idea is, nope, let's simplify. What we just did in terms of how do you recognize the symptoms, that simplifies. Onsets and upticks, go to emotions. Seemingly chronic, go to doubt. Plateau, go to power. There's And there's only a handful of ways that it needs to be simplified before it starts to click.
Mhm.
And I think it's much easier than learning like a foreign language. It doesn't take that long.
Yeah, agreed.
I find typically people, maybe for the first couple of weeks, are like, wait, what? I have all these questions.
Mhm.
But if you stick through that and you ask your questions, that's all you need to do.
Mhm.
That's another great thing about this is you don't need to do anything else except just ask your questions and make sure they're answered to your satisfaction.
Mhm. I love that.
And
Yeah.
it just becomes more and more clear.
Yeah, I mean, I love the way you put that. It's like you can master the mindset. Like if it's not, it is different than what most people have been taught, mainstream Western medical model. That definitely different, but it's not that hard. Like it's a whole system. Yes, we can hold that in one hand, and in the other hand, it's like you can master this. You can do it.
Yeah. And I find it can happen very, very quickly, actually. For some people, they get it, in a couple of sessions or from the seminars or from the book.
Yeah.
And then others are like, okay, I think I got it, but then I need to talk to you. That's why I run my groups, is so that people have regular and affordable access to me
Mhm.
to be able to ask their questions.
Yeah. Let me ask you about this. What you're saying about the power column, like recognizing, like recognizing what you've been through, like recognizing the like depth of the like trauma you've been through. It's funny hearing you say that. I remember you saying that in the seminar that I took, and to hear that back again, I'm like, right, like it's like you're telling my story without knowing my story. Because exactly, I mean, when I went to my own TMS therapy, that was the theme right there. Was like recognizing the depth of the trauma I've been through. That was the theme.
Yeah.
And I started this whole process for myself following Nicole Sachs and doing journal speak. And I would say same, like a big part of doing journaling every day for me was the same, was recognizing the depth of my trauma. And beforehand, like really not knowing that. So I'm curious if you could elaborate a little bit on that, just because I know it's the truth for me. It's the truth for clients who I work with who are TMS clients for sure. And I'm sure you've seen a bunch of people go through this. What advice do you have for people who are, in that space where like they don't even know to recognize the depth of their trauma? They don't know what's there. Like, speak to that a little bit.
Yeah. Well, there's many directions we could go. But one thing that I'll say is this: if your body's screaming,
Yeah.
then you did have that.
Yeah.
Somewhere in you, there's a part that needs to, I call it, receive the communication. These columns have different, the symptoms have different functions. In the emotions column, it's just to distract. It's like, in the moment, can't handle that, gonna blow a microchip. Let's just have a symptom and not process it.
Mhm.
In the doubt column, it's all about protection. There's this sense of danger. So
Mhm.
doubt's always coming in to protect, kind of like a helicopter parent, and you need to say, hey, we actually got this. We're okay.
Mhm.
But in the power column, it's about communication. There's a part of you that wants you to know you.
Mhm.
And if your body's speaking to you in these painful ways, there is some part of you that wants to know you in a different way. So
Right.
if you can take that as a given,
Mhm.
then you can move on to this next part, which I think could be really useful for a lot of people to think about this way. Typically speaking, people know what their trauma was. And some people don't, but
Mhm.
a lot of people do.
Mhm.
But they don't know the depth of it, just like you
Yeah.
said.
Yeah.
So I have this line, which is accepting the fullness of your trauma.
Mhm.
And the most important word in that is fullness,
I love that.
because I knew what had happened to me. I just didn't know what it meant. Good example. My father died when I was 6 weeks old.
Yeah. I'm sorry.
Of course, that's
So
upsetting.
sad. Yeah.
And then there was like the fear of mortality was like,
Yeah.
started from birth for me.
Right.
And I know that was hard. I knew it was hard right from the start.
Mhm.
But when I really looked at it, there were certain aspects I hadn't grasped at all.
Mhm.
For example, not having a father while other people did
Yeah.
made me, and I did not know this. Like, I knew that I didn't have a father. I knew it was hard. I knew I felt different from other people. But what I did not know is it made me feel that I was completely invalid. Just lesser than everybody.
Yeah.
And I did not know that because I didn't know the fullness of the trauma.
Yeah.
I knew what the trauma was.
Mhm.
but I didn't know the fullness of it. And this is a very typical thing that happens with doubt. Because we know the basics, we think we know the whole thing. So push past the basics and find out what does it really mean.
Great. Yeah. I think that's great advice. Push past the basics. Like you already, I guess, okay, let me just say this back. Some of the traumas people have been through, maybe they really don't recognize. Okay. Mostly you already know. So, okay, hold both and push past the basics. For it's like if you know you had this trauma, you call it trauma, call it hard experience, whatever you want to call it. Explore it. Push past the basics. I love push past the basics. That's good advice.
Yeah. And here's a great example of that with respect to my father. I knew I didn't have a father, but in a weird way, I didn't know that I would never have a father. You see what I mean? Like,
right. The parts of it that are not explored. Yes. Yep.
Yes. Somehow I held in my mind that, okay, I don't have a father, but it was like unconsciously, I was like, I don't have a father, but someday I will. No.
Right.
You know, that's not going to happen. And I needed to feel that, right? It's amazing how we construct realities that help us survive, but they lock us into a false position that we keep running up against it not being true. And that is what keeps us out of power. Being in power involves having pushed past the basics so that we really understand. I mean, I remember sitting on a beach realizing not only did I not have a father, but I never would.
Yeah.
And that was very sad for me. And I mourned it for a couple months, but I truly mourned it then. Yeah. Whereas before I wasn't actually mourning it because I didn't think it was true.
Right. Yeah. I mean, I'm thinking about how, what you're saying about communication. I mean, the body is communicating to you in the form of, symptoms, pain. And what stands out to me is that like the body's communicating to you, the body's communicating truth to like your fully conscious mind, like that part of your brain, which is also part of your body, but like the rest of the body is communicating to that. And you're afraid of it. Like you're afraid to get that truth. You don't want it. You're rejecting it on some level. And it is scary. I mean, what you're saying about like calling, I really resonate with what you said about calling a spade a spade. I do think if we were all able to call a spade better, we'd have a lot less chronic pain in this world. Because like it's scary to think about like, not only do I not have a father now, I will never. That is a scary thought that of course you resist that internally, right? Anyone would.
Yeah. But what's interesting, Sean, is that what ended up happening from that is I never looked for father figures anymore.
Hey.
And that was actually freeing.
That's power, right? That is power. Like, yeah.
I mean, it's part of why I was able to step into all kinds of leadership roles. I wasn't looking to a father figure to approve me anymore. I was like, I'm on my own.
Hell yeah.
But that's actually good.
That's inspiring. Yeah, that is inspiring. I love that. Okay, let me ask you this. I've got a couple more questions before we round out. So I interviewed Christina Sarno-Horner on the podcast a few weeks ago, and she said she said like the physical conditions considered to be like Mindbody in origin in her household growing up, like that was a much longer list than the typical like TMS list that one might like see. So I'm curious, like, because this can be like gray area, which is fine. But what symptoms or conditions have you helped people with that may not be like the obvious, like the clear TMS manifestations that are like classic, like chronic back pain, chronic IBS? Because a lot of people might not see themselves in those, or they have those symptoms, but they have other symptoms that they're like, could this be? So I recognize there's some gray area here, but like what have you seen in your experience resolve with this work that's kind of like, not the typical symptom?
Yeah. Okay. There's so many directions to go in. I feel like I want to come back and talk to you again because
great, let's do it.
It's just so much. But first of all, head to toe, if the body can do it, the mind can use it. So it doesn't matter what system it is or what symptom it is, it can happen for mind-body reasons. But now I'll speak to just a couple ones that are like not the typical ones that you just wouldn't think about. Here's one that really kind of blew my mind. I have treated people for this is a delicate topic.
We're used to delicate.
The anal region.
We literally just had a whole podcast on that, Dan. You can go back and
anal fissures can be cured with mind-body work because they're all about tension.
That's amazing, and it makes sense.
I mean, there's the phrase being a tight ass, but
yeah.
Which I'm not saying those people are, but
right,
we're tense,
right?
And if you're tense, things are more likely to tear or have a problem. When I help people with that, it resolves it. But there's also things like weird sensations where people are just like, I have this weird smell that comes up. And it's always around this one area, and we find out it's actually not related to something from the environment. It's an internal process.
Interesting.
Perceptual things like that, where you just feel like, even weird things like time moving faster, like that's a perception, and you can alter things like that by syncing up with yourself. When you're in your power, it's like how I'm a sports fan, so sometimes I talk about how like the game will slow down when you're in your flow. And the same is true in life. If you're in power, it slows things down. But another good example are things like the psychological things like depression, anxiety, obsessive thinking. Like these are not things that people tend to think about as mind-body issues, but they are.
Yes, that's such a good point.
So like when people talk about depression, they think, oh, well, you'll have to work at that for a while, or you'll have to go on medication. And I'm not saying anything negative about any of that as potential solutions. But what I like to do is always call into question, am I really stuck with this symptom? Or is this something that I can resolve more quickly if I can just understand what it is? All kinds of things. Tooth pain, like itchiness, numbness. A lot of times people have a hard time believing that could be mind body. People can lose their hair. There's all kinds of things. It's just
right. Okay. Yeah. No, good. Yeah. No. And thank you for sharing that, because, going back to what you were saying before, the doubt is so strong, and so many people come to this work like, is my symptom TMS? And you just lengthen the list for people. So thank you. that is helpful.
Yeah, in my book, I listed it's got to be like 200 things because there's many more. But I knew that people were going to go to this book and be like, can this cause vertigo?
Right.
Can this cause blurry eyes?
Right. And the answer is yes and yes. So there you go.
Yeah. And actually, typically all of these symptoms, though they can be caused for medical reasons, it's very rare that would be the case. Almost always it's mind body.
Yeah. Yeah. No, that makes sense. Okay. Let me ask you this. If you had a soapbox message that you wish you could share with everyone who's like walking this path and healing from chronic pain, what message would you like to share with everyone?
I'm sorry to ask a question in response to the
go
question,
ahead.
but is this for the recoverers to have hope, or is this for the broader world in terms of understanding?
Oh, this is for the recoverers to have hope. There's so broader world.
I was going to go towards the broader world thing.
Yeah. So when you come back, we'll do maybe.
All right, we'll do the broader world
thing.
Yeah. The main like soapbox message I have is you make sense and your symptoms make sense. You will never not make sense. Ever. And if you start to think that you maybe don't make sense or it's just random, that's when doubt can take over. You've got to so I do crossword puzzles when I have time, which is not as frequent as it was. But when I do crossword puzzles, you have to assume there is an answer and you can get it, or else you will not get the answer. Like you could just be like, it's impossible, I give up. You make sense and your symptoms make sense. It is never, ever, ever not the case. And I find that the columns are a very, very helpful like detective system to figure out how you make sense and why you make sense in this moment.
Mhm.
So never give in to the idea that you don't make sense.
Mhm. Mhm.
And by the way, I'll add this: if you think that you don't make sense from the things that you're reading out there or whatever, that's the rest of the world not doing a good enough job explaining it. It's not that you don't make sense.
Beautiful.
Everything's explainable. We just need to
Beautiful.
figure it out.
Beautiful. Yeah, I love that. Your mind-body recovery is like a crossword puzzle. Like, it makes sense. There is an answer. Like, one letter belongs in all of those little squares. There's not question marks and confusion. Like, even if you don't know yet, you can know, like, it will make sense. That's beautiful.
Yeah.
And it reminds me of what you said before, like, push past the basics. I mean, I think that's such good advice. Like,
Mhm.
it will make sense if you just keep working it. Keep walking the path, push past the basics.
Mhm.
Beautiful.
Yeah.
Okay. Well, as we're rounding out, where can people find you? Like, what are you? I mean, I know you have the book. Tell us. People I'm sure listening want to engage with your stuff. So how can they do that? What are you offering, and where can we find you?
Sure. So my website is www.crushingdoubt.com. You can find all about me. You can find all of my resources, including the seminars that Sean talked about, and my groups, and how to sign up to come see me. I do individual consultations as well. They're more expensive, and they are sometimes there's a wait list because it's high demand. But I will help you in any way that you need. I also train people. I have people I've trained. I refer to those people, so you can get a whole system set up around what you need at that website. In terms of the book, you can get the book on the website, and there's a whole separate section of the website, www.crushingdoubtbook.com, if you want to check that out. But it is available on Amazon, and a lot of times people opt for Amazon because it's fast delivery. And one advantage is then if you are willing to post a review, it's extremely helpful. Because if you think about it, people are going through, they're looking for resources and they're seeing, is this legit?
Absolutely. Right.
It really helps. So if you've gotten help from the book, or you're willing to read it and see, and you have a positive response to it, please leave a review on Amazon. But the main way is through the website. You can contact me by email through that website as well. So that's for everything. Go to www.crushingdoubt.com unless you want to order the book from Amazon.
Awesome. That sounds great. Awesome. Well, Dan, it has been such a pleasure. I've gotten into such interesting topics, and I'm sure everybody listening has gotten so much out of this. Truly, thank you so much. And if you ever want to come back, let me know. We'll be here.
I definitely want to come back. I know you've got your own flow in the show, so when you're ready, just ask me. I'll be there.
Awesome. No, I'd love to have you. Cool. And for everybody listening, this has been Mind Body Medicine for Chronic Pain, and I will plan to see you next week.